Hi everybody, it's Dr. Magnifico from JRSLVet.com. I am here with my good friend Suzanne, who's slightly off camera, but we'll give you a little wave.
I'm sitting on the floor. I sit on the floor all the time.
This is our workspace. And we are talking about trying to provide like an infographic or some literature, and Pabli is working on this too, sort of as a sidebar, so that you can save money if you end up at a veterinary clinic and the cost of care is more than you can afford. So she's sort of picking my brain. And some of the things we have talked about are, I tell people that it's really, I say this all the time. I don't say it publicly. I haven't said it on YouTube yet, but I will say it now. The system is rigged. You can walk in, it is. You can walk into any veterinary clinic anywhere at any time, and you can get a price that you can't comparison shop elsewhere, is not regulated, meaning there's not one price for anything anywhere. It's all based on competition. Competition is strongly influenced by time of day and access to information or to other providers. So if you walk into an ER at 2 o'clock in the morning and your dog has a pyometra, this is my favorite scenario, and they give you a $4,500 estimate, how can you work that estimate down to something that's affordable? Well, the first thing that I said was, you just tell them that you're going to get out alive. I use get out alive a lot, and I mean it. You tell them that you are not going to sign a euthanasia consent form based on an economic euthanasia being a treatment option, and you say we're going to work from there. So economic euthanasia is off of the table. My dog is going to, or cat, is going to get out of here alive, and I need to figure out a number to make that happen. After that, we're going to use dog as the scenario. Your dog you have walked into the ER or your vet's office, your dog has been examined. That veterinarian is going to come back to you and say, I suspect your dog has this. If the answer is pyometra, I suspect your dog has a pyometra. They are then going to say to you, here's the written estimate. So they are going to give you a written estimate. If they don't give you a written estimate, you should ask for a written estimate. You want them to itemize every single thing that treatment plan entails. And then you go through it line by line by line. The next piece of advice that I gave Suzanne was, you say to them, okay, here's the list. What's treatable and what's not treatable? Because if something like a brain tumor is on there, I'm going to say not treatable. There probably are people who would consider treating it, but overall it's not treatable. So you go through the list and you cross out all of the differential diagnoses that are not treatable. You start with a conversation with that veterinarian. What's the most likely scenario, and what's your degree of confidence in that? So if they say, I am 95% this is a pyometra, you cross everything else on that list out and you start targeting that. So you need to target the treatment plan that's affordable for a pyometra. In my opinion, if we're dealing with a budget, which we do all the time here at Jarrettsville Veterinary Center, that means you need surgery to get out alive. In most cases, those pyometras are only treated successfully, or most often treated successfully, with surgery. So how do I make surgery as my treatment option affordable? If it's at the ER, you probably have to say, I need you to get me through the night so I can go to my primary care veterinarian to get it affordably. If that means IV fluids and antibiotics, that's what you need to get out alive, and that's what you ask them. If they are giving you treatment plans that are ancillary, meaning we want to do a full blood work, we want to do x-rays, we want to do an ultrasound, you have to say, I need you to pick the diagnostic that's going to give you the best answer, and that's where we're going to focus our resources on. Don't do the blood work, do the ultrasound, and do the x-ray, and then run out of money for your surgery. It happens all the time. They use up all of their money on the diagnostics to get themselves a 100% diagnosis, and then they have no money to treat your dog. And what good does that do you? It doesn't do you any good. So talk to them.
Can you as the pet owner decline those diagnostics?
You certainly need to ask them. Needs to become a conversation. If you are not starting out with a conversation, meaning it's not, I have this amount of money, or I have this amount of resources, I have this amount of time, then ask them, then ask them, how do we get it? How do I get to that place where I've got something that's workable to get me an answer that I need? It has to be a conversation. If you're not having a conversation with that veterinarian, you need to ask to find somebody who will have a conversation with you, or you need to leave. And it is perfectly acceptable to leave. In lots of cases, the ER will ask you to leave because you can't afford the care that they are only willing to give you. They are not willing to go through option A, option B, option C, and option D. They're going to give you option A, which is the gold standard, which is a whole separate conversation, or they're going to give you economic euthanasia for $100. And I was just telling her that in a lot of cases, I think a lot of pet owners feel like it's a $4,500 thing that I have no way I can afford, or it's $150 humane euthanasia. and your dog might die anyway. This idea that there's a guarantee that your dog's going to survive, regardless of how much money you have, or how many options you've got, or how many resources, or how many people, is illogical. Your dog might die no matter what. So talk through the itemized list with them. If you feel like they're not negotiating or they're not being helpful, ask them to refer you to somebody that will, or go to another ER, or say, I need you to get me through to the morning, and then I'm going to go find somebody who will help me. And then you go through that list and you find someone who will help you. The underlying problem is that there is there's no regulation of what things cost. There are people, veterinarians like me, who will work with you almost regardless of what your price point is. And then there are places who are not going to work with you at all, period. If you don't have the high end of the estimate and you don't leave a deposit, they're going to ask you to leave. And that's not a relationship. So this whole kind of project of trying to figure out some way to help pet owners make smart financial decisions so that they can get to an outcome that they're happy with is almost impossible. Unfortunately, it's almost impossible. I'm hoping that Pobly will help. I'm hoping that with other people sharing their stories and their information that will help. But you can't just go in there and say, well, I'm going to decline the IV fluids, or I'm going to decline the pain meds, or I'm going to decline the antibiotics, because the veterinarian has to worry about liability. And then the more you decline, the more they have to accept a degree of liability, which many of us are just not willing to do. We live in a land and age of liability, and nobody wants to get sued, and no one wants to feel like they participated in less than ideal standard of care. You are there just trying to get your pet out alive, and we're here trying to make a profit, protect our butts, and then live to see another day too.
Can a pet owner decline diagnostics and have them put that in the medical record, though?
So you can decline anything. As the owner of that pet, which is what you are, you can decline anything. The veterinarian can also decline to help you at any point along the way. I can decline to help somebody because I feel like we're not conversing effectively. I can decline because I'm not comfortable with the degree of risk that I'm assuming. I can decline because I don't know how to do the procedure. That's a very real thing. Not every veterinarian has the same skill set to do something, so you can decline. So that's really what happens. That's what a lot of people feel like. They feel like if I don't take that, the estimate is this, and I have to leave a deposit for the whole thing, that they're going to decline to help my pet, period. So a lot of veterinarians are providing a very high estimate for a gold standard of care, being the owner is being asked to provide a deposit, and then the owner doesn't want to start scrutinizing because you feel like your pet's going to pay for it. Right.
Well, you're also, as a pet owner, a lot of times you're frightened. I mean,
right.
You don't understand what all this information means. So the goal is there a way we can empower pet owners to have productive conversations with their vets about reducing costs if they can't afford the top tier, the gold standard? Is there a way to conservatively medically manage their pet? You gave one suggestion already, which is to say, can you stabilize my pet and for overnight give IV fluids, antibiotics, gastroprotectants, or whatever to get us through to the morning when I can get to my regular vet where it will be less costly.
And probably most veterinarians will say that's okay. Yes, I understand you can't afford the $4,500. Let's go with the $800 overnight care, but you have to understand that your dog might die, and you're always going to get that preface, and that's what sort of coerces people to try to do more than they probably can afford. And yes, that's the consequence. You make a decision. We're trying to do everything we can to get your pet out alive with all the things that they need. And then every time we cut a corner, there's a price for it. So it just has to be, how much am I willing to cut and how much are you able to afford? So it's this constant negotiating. And then a lot of veterinarians just don't want to negotiate anymore.
Okay. Yeah, it's unfortunate because pet owners feel caught between a rock and a hard place. They feel they're frightened. They're not the experts in this. They know they have budget limitations. So they're looking for ways to try to lower the costs. They want to know the associated risks. So they do want to be informed to be able to give informed consent.
Right. I think when we're talking about the big ticket items, which are the pyometra, the time really matters. All of us know that you might not have 24 hours. You might not have 12 hours. And if you do have 12 hours, your prognosis might be half of what it was before. How much are we willing to risk and how much are we willing to negotiate based on that? For the little things like vaccines, that's a no-brainer. You can find some place that does rabies clinics. You can find some place that just does vaccines only. So that's something that the consumer can navigate through. But in these times of need, with a surgery, and I'm going to say that, or a service needed, yeah, you don't have time on your side, and you certainly don't have negotiating on your side. Are there ways to cut corners? Maybe, but I think, unfortunately, they're too often so little that it doesn't get you to the outcome you want to be.
Okay.
But that's just go to the next provider. You know, if you feel like you can't get what you need there, leave your pet at that ER, and then 8 o'clock in the morning, go pick your pet up and go to your private practitioners and say, I need help. And if they say, I can't help you because I don't do that surgery, then call the 10 other veterinarians in your area to find someone who can. While you're doing that, ask family and friends to help you with the finances, because if it is a pyometra, you probably need a surgery.
Right.
Have I done pyometras medically? Yeah, I have. You know, if at the end of the day, if we have no other option, you put them on fluids. Sub-Q fluids is still something else to talk about, antibiotics, and you do a lot of finger crossing.
Right.
And then you get that dog spayed a month later at a low-cost spay and neuter clinic and just breathe a sigh of relief. So this is something that we will work on.
Yeah, we're not going to give up trying to come up with
but this is the debate that we have.
Infographic to help guide people to know what kind of effective questions you can ask of your vet when you're looking at estimates and you're concerned about cost. And is there anything that you can skip that's not going to drastically increase the risk?
And and that's such a case by case specific thing that I don't know. Yeah. And then feedback is important. You know, if you go to a veterinarian or a veterinary clinic and you feel like they didn't talk to you, they didn't negotiate, they didn't get you to a place that you needed to be, there are things like social media, and there are things like Yelp, and there are things like Google, and there, you know, you can rate somebody, you can leave an impression. This is, veterinarians need to feel like they're all part of the consumer marketplace, which we are in every other arena, and that if you leave a bad review, it sticks. If you find somebody who won't help you, you're not going to refer anyone else to them, and you're not going to go back to them. And then, if they're just trying to live on gold standard of care, and the 1 in 10 people who can afford $4,500 on a pyometra, at some point their bottom line will be hurt bad enough, hard enough, and significant enough that they will start offering it in the more affordable range again. All right, we'll follow up with our infographic. Thanks for sticking with us. If you have any questions about this, please find me on Probably.com. If this is happening to you, please go to Probably.com. Please give me your story. Please give me your estimates, and please use the storyline section. I'm really hoping that's a way that we can help other people learn from others' experiences. Take care. Bye.
Bye.